Well, it sounds like this problem with heartburn has really been giving you a lot of trouble and made it even harder to go to sleep.
Oh
I'm
yeah.
curious, do you take anything at bedtime or eat right around bedtime?
Uh, Sometimes I'll have something to eat or something to drink. Yeah.
What would you typically drink?
Oh, sometimes I'll have a little bit of vodka with maybe a brownie or something.
Uh-huh, yeah. How
Yeah.
much vodka would that be?
Oh, yeah, maybe 2 glasses sometimes. Yeah.
And a glass is like an 8-ounce water glass or just like a little shot
Probably,
glass?
like one of those 12-ounce glasses, probably about half of that. Yeah. I'll do like maybe two of them or something.
And that's to help you go to sleep?
Yeah. Yeah, sometimes to sleep, sometimes just to relax and if I'm feeling a little edgy, you know.
And do you do that every day or would that be just kind of a once in a while thing?
It's kind of a habit. Yeah. Yeah, almost every day.
Uh-huh,
Yeah.
uh-huh. Well, part of my concern here is around the amount of alcohol that you've been drinking. Um, do you feel like that's an issue or problem for you?
Uh, I wouldn't say, I'm like a raging alcoholic or anything, but yeah, I go through a couple bottles a week. That's
Uh-huh,
uh, probably not a good idea,
uh-huh,
but
uh-huh. Is
yeah,
is that something you would like us to help you with?
you know, yeah, actually that's probably a good idea. I've got this reflux and everything, and I I don't want to keep making myself sick, and
Got it.
I don't want to end up, really sick.
Yeah,
But,
yeah. Well, I think there's a lot that we can offer to you besides just treatment for your reflux. One thing I think would be helpful at this point is to involve our behavioralist. That's our behavioral health consultant, Jennifer Sales. She works right on the team with me. You've probably seen her around the clinic before.
Yeah, I think I know who she is.
And what I'm going to do is ask her to come in. I'm going to have a couple of forms for you to fill out. Fill out for me. They're actually questionnaires that give me a little bit more information that will be helpful. One is called the mini, that's real general. The other one's about other kinds of recreational drugs that you might be using. It kind of helps us really advise you, and this is all completely confidential.
Okay.
So we're right here. It's all confidential, and it's helpful for me if you answer really honestly. Okay.
Okay.
So I'm going to give you these to start with, and
Okay.
I'll be right back in.
Thank you so much.
Okay, Joni.
Thank you.
I'll be right back. Well, Joni, this is Jennifer Sale.
Hi.
How are you?
Good. How are you?
Good, thanks.
Jennifer is our behavioral health consultant, our behavioralist here at the clinic, and is the one that works with us on a whole host of lifestyle issues, not just alcohol use. I've got your questionnaires here that you just filled out, and it looks to me like you may actually be having a little trouble with anxiety sometimes too, and it looks like you've also been using some other recreational substances too. So, these are all things that I think we want to make sure we address with you for your health. I think what I'd suggest to you right now is why don't I let you and Jennifer get a little acquainted and go through some of the things that you might do together with the kinds of behavioral things that she does. And then you and I can wrap up later and talk about some of the medical things that we might do for this. I want to make sure that you're comfortable and you sleep well at night and your reflux is well taken care of.
Okay.
Okay? So I'll leave you to it. Very
Great.
good.
Thank you very much.
Okay, Joni.
Thank you.
Hi, Jenny.
Hi.
Hi. So, Peter's telling me that there might be a problem for you with overuse of alcohol. Is that what you're feeling?
Yeah. I thought I was fine. I started out, just having a drink when I got home just to feel, relax and calm down a bit. And I thought I was okay. A couple of my friends had mentioned, when we go out or when they come over and watch a movie with me that I drank a little bit too much. And I thought no, but I'm starting to think that maybe, now that I have this reflux, You know, it's like maybe I'm doing more harm than I thought I was. And
Is that how much are you
Yeah,
drinking just in general?
probably, you know, about half a glass full, like 2 of those, you know, right before I go to sleep.
Okay.
Yeah.
So you are using it to help you get to sleep.
Yeah, yeah.
Okay. So it's become kind of a habit.
Oh yeah,
To help
yeah.
you
It's
sleep.
you know, I have trouble sleeping, and it's just like, you know, my mind will race, and I'll have a couple drinks, and it just relaxes me and helps me.
Have you ever actually thought that, you know, that this was getting to a stage where you're becoming kind of dependent on the alcohol?
Yeah, I lately, you know, you start seeing the same person at the store, you know, checking you out, and you know, when you're buying it, and it kind of gave me a funny look the other day, and I thought, well, you know, I don't drink that much, but then I started thinking about it, and yeah,
If you don't drink, how do you feel?
really, really anxious. Like I just really, I feel like I can't calm down until I have it,
Ah, okay.
you know, and
Okay.
you know, I don't know. It just relaxes me, and it helps me sleep.
Yeah, I understand.
You know.
It sounds like you might have become dependent on it. Is this something that you'd like some help with?
Yeah, I think it's time. Yeah, because I mean, you know, as much as it helps me feel better, it's like if I want to live longer and be healthy, it's probably not a great idea.
Yeah, those
So,
are good thoughts.
Yeah.
Yeah, okay. Well, you know, it does sound like you're using it to deal with anxiety, to keep yourself calm and enable yourself to get to sleep. So there are some other ways that we can talk about, some behavioral methods we can talk about to help you with that instead of using the alcohol. But, you know, because there may also be a physical dependency here, we kind of want you to sort of participate in a little bit of a program, which is a couple of different components. If you would like to do this, and part of it is coming to individual counseling regularly for a while, and looking at, you know, what the triggers are here, and maybe some different ways you can think about your life, and some specific things you can do to replace this.
Okay.
And then also possibility of maybe a 12-step group, possibly AA, if you feel like that's something you might want to do.
Maybe. Yeah.
Okay. Well, we can talk more about that later.
Okay.
That, you know, can be very helpful because you get support, and it's something that you're responsible to doing on a regular basis, and that element of accountability is really helpful.
Yeah.
You know, so,
Okay.
but we can talk more about that later.
Okay.
But anyway, I think we've got a good start here.
Okay.
And maybe we can just talk some more in a longer session.
Yeah, I'd like to, because
Okay.
like the only time I ever really go out in groups of people, I'm usually binge drinking, and so the whole idea of going to a group of people,
Yeah.
just I don't know, but yeah,
Yeah.
maybe we can work on it.
Okay.
Yeah.
Okay. All right. Well, you know, maybe you could just come back at least for one more session, and we could just talk
Oh,
a little
yeah.
bit about the possibilities.
Okay.
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 All right. We'll set you up for an appointment.
Okay.
Good
Thank
to
you.
meet you.
You too. Thank you so much.
You're welcome.
All right.